on layoffs and furloughs. Can you just tell us where everything is right now?
Yeah, so first to kind of set the stage, we've talked about this a lot of times about what the effect of this pandemic has had on healthcare and healthcare finances in general, and on the Mohawk Valley Health System in particular. And we have a huge so there are two things. Number one, we have a huge financial hole that we're trying to manage our way out of, and we are getting a little bit of help from the federal government, or we have gotten some, but it certainly hasn't been enough to right that ship. So we've been looking internally into how to do it. The other part of this is healthcare is different than it was a year ago. People are not coming to healthcare facilities, whether it's a doctor's office, whether it's a dentist's office, whether it's a hospital, because they're concerned, because
Yep.
that's where COVID lives, or at least that's where they think. And with everything that we've been doing, and all the hospitals have been doing in terms of making their facilities safe and clean, and the additional disinfecting and the additional processes that we've put in place, it is going to be a while before people feel comfortable with that. The other thing is that those processes themselves make providing the care less efficient and therefore more expensive. So with all of those things together, we, as a senior leadership team here in the Mohawk Valley system, have been saying, what is our new normal, and how can we make sure that we are going to be here for the long haul for this community? And that is to basically to try and recover as much of our revenue as possible, but also to restructure ourselves into what this community will need going forward.
The story also out today talking about how hospitals around the country, and pretty much all hospitals have gone through this, collectively have lost billions of dollars. So you guys seem to be by no means alone in the. And then those that were able to escape it, the Midwest and other places, well, they're being hit right now. So it seems like everybody's been hit with this around the country.
No, that's exactly right. There was some testimony yesterday in Albany by the Healthcare Association of New York State called Haney's, and their leadership that basically said that the hospitals in New York State, just New York State, are losing billions and billions of dollars, and it would not be surprising if every hospital and hospital system in New York State ends up in the red this year.
Yeah.
And that is going to, and we're all looking at how we can realign what our resources are in such a way that we can continue to provide the care to the communities that we all serve. And looking at the healthcare quote-unquote trade journals. You can look at what's going on at the University of Rochester. You can look at what's going on at St. Joseph's in Albany, or in
Syracuse.
You can look at what's going on in the Albany systems, and those are big systems, and then you look at the smaller rural hospitals who were already teetering on the brink. And it is quite possible that we're going to lose some rural hospitals in this state.
What was your reaction to Dr. Howard Zucker saying that hospitals all along had plenty of PPE available at their disposal throughout the
well, he said through the peak, through the height of it, they had everything they needed.
Well, I will say that we made do with what we had, and certainly, we continue to do cleaning on certain components of the PPE, whether it's the N95 masks or the face shields or the goggles, so that we can reuse them. If you look around the country, there is not an overabundance of PPE, and as new areas become hotspots and they start to use more, while we all are trying to conserve as much as possible to be ready for what's happening in the fall, I really applaud healthcare facilities across the country in terms of being as resourceful as they have been. So an abundance, I would not. That's not the word that I would use.
No, and we were never really over 50% capacity, were we?
No, we actually. So again, partly because of the fact that this community has done so well in terms of protecting itself and protecting each other, and because of everything that was shut down. Actually, our inpatient volumes went down significantly.
Yeah.
But at one time, given that, at one time, a full third of the patients that were in our inpatient beds were either COVID positive or patients under investigation.
Furloughed workers have been told they have no job anymore. If they want to apply for a job, they're considered as anyone off the street, no matter how many years they've been with the hospital. Is that correct?
So this is my understanding is that if you reapply for another job within the health system and you have not been in the health system and your time of departure was less than 30 days, then you come back with the same level of benefits and seniority. This would not necessarily be true for members of the unions, and that's only because unions have very specific contracts, and so each of them would be different. But if it is beyond 30 days, then that statement would be an accurate statement.
Tomorrow morning, 7:40-ish, I want to get with you and really focus all on schools tomorrow. There's a lot of debate going back and forth, so that'll be a date for tomorrow morning if you're good with that.
That's perfect. I think that's a great conversation to have.
All right, Doc, we appreciate your time. Dr. Kent Hall, have a great day, and we'll speak with you tomorrow morning.
Thank you, everybody. Be safe.
You do the same.